This medication is a hormone called estrogen. It is used by women to reduce vaginal and urinary symptoms of menopause, such as vaginal dryness, burning, itching, painful urination, and frequent urges to urinate. These symptoms occur because the body produces less estrogen during menopause. When treating only vaginal symptoms of menopause, it is best to use products that are applied directly inside the vagina, like this medication. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risks of side effects due to more estrogen being absorbed. The usual dosage is 1 ring inserted into the upper third of the vagina and left in place for 90 days. It is best to use it at the same time each day, and it can be inserted at any time of the day. Before using the estradiol ring, make sure to read the patient information leaflet provided by your pharmacist. It's important to understand how to use this medication properly. If you have any questions, don't hesitate to ask your doctor or pharmacist. To insert the ring, wash and dry your hands first. Then, carefully place the ring high into the vagina as directed. The ring should be left in place for 90 days, and then replaced with a new one if the treatment is ongoing. It's essential to follow the dosing schedule carefully and not leave the ring in place for longer than 90 days. When the ring is inserted correctly, you shouldn't be able to feel it and it shouldn't interfere with sexual intercourse. If you can feel the ring or experience discomfort, it may not be placed high enough. Gently push the ring higher with your finger. If the ring falls out, rinse it with lukewarm water and reinsert it into the vagina. Contact your doctor if the ring falls out often. When it's time to remove the ring, gently hook your finger through the ring and pull it out. Discard the used ring in the trash, and do not flush it down the toilet. It may take 2 to 3 weeks before you experience the full benefits of this medication. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of estradiol ring, vaginal may include nausea, bloating, increased vaginal discharge, breast tenderness, headache, or weight changes. Remember, this medication has been prescribed to you because your doctor believes the benefit to you is greater than the risk of side effects. However, it's important to tell your doctor if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, severe stomach/abdominal pain, or swelling hands/ankles/feet. Estradiol ring, vaginal may rarely cause serious problems from blood clots, so it's important to seek medical help right away if you experience symptoms such as chest pain, sudden/severe headache, weakness on one side of the body, or trouble breathing. There's also a rare risk of a very serious bacterial infection, so remove the product and seek medical help if you experience symptoms such as high fever, unusual muscle pain, or a sunburn-like rash. In the case of a serious allergic reaction, get medical help right away if you notice symptoms like rash, swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Estrogen, whether used alone or with another hormone, can have serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogen should not be used to prevent heart disease or dementia. Using estrogen can increase the risk of uterine cancer. Taking a progestin as directed by your doctor can help reduce this risk. If you experience any unusual vaginal bleeding, be sure to inform your doctor right away. In postmenopausal women, using estrogen, with or without a progestin, can increase the risk of breast/ovarian cancer, stroke, dementia, and serious blood clots. When used with a progestin, estrogen can also increase the risk of heart disease. The risk of serious side effects may depend on the dose of estrogen and how long it's used. This medication should be used at the lowest effective dose and for the shortest amount of time. It's important to discuss the use of this medication with your doctor and check in with them regularly to see if you still need to take it. If you will be taking this medication long-term, you should have regular complete physical exams as directed by your doctor. Before starting to use the estradiol ring, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, be sure to discuss your medical history, especially if you have a history of certain medical conditions such as blood clots, heart disease, diabetes, or high blood pressure. It is important to avoid smoking or using tobacco while using this medication, as it can further increase the risk of certain health issues, especially in women over the age of 35. If you are planning to have surgery or will be immobile for an extended period, talk to your doctor about any precautions you may need to take. Be aware that this medication may cause dark patches on the skin, so it's important to limit your time in the sun and use sunscreen when outdoors. If you wear contact lenses, you may experience vision problems, so be sure to contact your eye doctor if this occurs. If you develop a vaginal infection while using the ring, it's recommended to remove it until the infection has been treated. Additionally, it's important to avoid using this medication during pregnancy and to consult your doctor before breastfeeding while using it. It's important to be aware of any potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's also essential to not start, stop, or change the dosage of any medicines without your doctor's approval. There are certain products that may interact with estradiol ring, vaginal, including aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, which could potentially lead to false test results. It's crucial to inform the lab personnel and all your doctors that you are using this drug. If this medication is ingested, it can be harmful. If an overdose occurs and the individual experiences severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as unusual vaginal bleeding. It is important to take this medication as prescribed by your healthcare provider. The usual dosage is 1 vaginal ring inserted into the vagina and left in place for 90 days. It is best to insert the ring at the same time each day for optimal effectiveness. Remember to follow the instructions provided by your doctor for the best results. It's important not to share this medication with others. While using this medication, it's essential to have regular complete physical exams which include lab and/or medical tests, such as blood pressure, breast exam/mammogram, pelvic exam, and pap smear. Make sure to follow your doctor's instructions for examining your breasts, and report any lumps right away. It's important to keep all medical and lab appointments. If you need more details, consult your doctor. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes that can help to control or prevent these diseases include reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking. Additionally, keeping your mind active with mental exercises, such as reading and solving crossword puzzles, can help prevent dementia. It's a good idea to talk to your doctor about lifestyle changes that might benefit you. If you forget to insert a new estradiol ring after 90 days, it's important to consult your doctor or pharmacist for a new dosing schedule. When it comes to using the estradiol ring, vaginal, it's important to store it at room temperature and keep it in its pouch until you're ready to use it. Make sure to keep it out of the reach of children and pets. When you no longer need the product or it's expired, it's important to dispose of it properly. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.